This week is also Hearing Awareness Week, and the theme is How Loud is Too Loud. I attended a breakfast this morning for Hearing Care Industry Association have every year in this place to focus attention on those with a hearing loss and hearing impairment. Already 1 in 6 Australians is affected by hearing loss, and as our population ages, we are anticipating that there will be an even greater proportion of Australians affected by hearing loss or hearing impairment, and in fact it's projected to increase to 1 in 4 Australians by 2050. Hearing loss is one of the most commonly reported long-term conditions in the Australian population. 13.7% of males and 7.4% of females report a hearing loss in the last National Health Survey. Hearing loss costs Australia $11.75 billion annually in lost productivity and other impacts. Clearly, this is a very, very important issue. 1 in 4 people who could benefit from a hearing aid have one, and there is an average. Sorry, I should say only 1 in 4 who could benefit have one, and there's an average of 7 years between a person needing help with hearing and actually seeking help. Hearing-impaired adults are often unable to afford hearing health services, and this can seriously impact on their lives and seriously disadvantage them in their life outcomes. Their ability to participate in training, education, employment can be limited, and their family and social life can be very severely disrupted. This places them at a higher risk of developing health and interpersonal issues arising from communication difficulties, social isolation, and those impacts obviously then affect their life outcomes. There's a large number of people who have a hearing impairment or hearing loss who are unemployed or are underemployed. Without hearing rehabilitation, hearing-impaired Australians can be expected to suffer losses in remuneration due to underemployment or, as I said, not in fact being able to find a job. They can experience discrimination at work, find it harder to engage with work, and of course we know what the impacts of being kept out of the labour market is. We know that there are a large number of Australians who, as I said, are suffering hearing loss or hearing impairment who are of working age. Employment rates for hearing-impaired people between the ages of 45 and 65 are lower than comparable people in the broader population, 20.5% lower for men and 16.5% lower for women. So these figures show that we have a significant issue here with people with a hearing impairment and unemployed. Now, and unemployment engagement with employment. So these are the sorts of people who are going to get caught up in the government's push to dump, for example, younger people off income support altogether, and to force people onto work for the dole and those sorts of measures without actually addressing their hearing impairment. There is no doubt that the Commonwealth Hearing Services program is an outstanding program, and we found that in our Community Affairs inquiry into hearing in Australia, the Hear Us report that we did, and it does provide absolutely a world-class service to eligible clients who are young people under the age of now 26. And I'm very proud to have been or to have chaired the inquiry that actually recommended that the Commonwealth Hearing Program be extended to people beyond the age of 21. It was only until a couple of years ago that people up to only the age of 21 could get access to those services. Now it's 26. Unfortunately, this leaves a whole group of adults who are not able to access hearing services. And I've just explained how people are isolated from employment, so they don't have the capacity to be able to buy hearing aids. And hearing aids have really improved with technology. They're absolutely amazing what they can do with hearing aids now, but that technology means they are very expensive. And so people, particularly on low incomes, aren't able to access these programs, aren't able to, or if they're on in either underemployment, aren't able to, they don't have the resources to access hearing aids. It's a self-fulfilling prophecy almost, because then they can't. Their hearing is keeping them out of the workforce or keeping them underemployed without being able to earning the money to get the hearing aids. They can't get the additional training or get the jobs, in fact, that they're qualified for. This morning we heard two very good examples from two women that presented to the breakfast and told us of their experiences with their hearing loss and hearing impairment. And it definitely has affected people's ability to find work and stay connected to the workforce. We desperately need further investment in hearing health, and in particular helping those people that cannot access hearing aids. Because if the government's talking about wanting to improve connection to employment and getting people into the workforce, with somebody who has a hearing loss or hearing impairment, you know what you do? You fund hearing aids, and then you'll see people blossom and be able to connect with the workforce. Though, instead of penalising people, those are the sorts of things that help people gain employment. I can't not talk about hearing and hearing loss without talking about Aboriginal and Torres Strait Islander peoples. Now, I have spoken a lot in this chamber about the impact of otitis media on the hearing health of Aboriginal and Torres Strait Islander peoples. Otitis media is at pandemic levels in the Aboriginal and Torres Strait Islander community, and this impacts on the rest of their lives. It impacts on their early learning, it impacts on their school experience, and it connects through to their life outcomes. If it's not dealt with, there's social isolation, and I've also highlighted this place to the impact that it has on people's connection to the justice system, and the fact that a large number of Aboriginal and Torres Strait Islander people in the justice system have a hearing loss or hearing impairment. If we actually deal with that hearing loss and hearing impairment when their children are small, early intervention, obviously deal with the OM, that obviously needs to be dealt with, but when somebody has already suffered that impact, we need to be making sure that they have the support, the early learning, the early access to numeracy and literacy programs, because that is where we know, all the evidence shows that that's where the impact you can make the most significant impacts, is making sure they catch up before they go to school. The average child, the average Aboriginal and Torres Strait Islander child who is exposed to OM has spent the first 32 of their 60 months of life with an ear infection. We definitely need to be addressing otitis media, and there are some very good programs and very good research being carried out. But the point here is that we also need to be investing in specially focused early learning, early intervention with those literacy and numeracy programs. It is a key area if we are to address and improve a child's life outcome, is to make that investment. And it's not just about ticking the box in terms of a child has access to an early childhood centre. They actually need those specially targeted programs that are specially targeted, because as was found out during our Senate inquiry, is that your brain allocates its hearing and language, a section of its brain, by the child is around 6 months old. So if a child has a hearing loss or hearing impairment that has come on very early, which is what happens with otitis media, the brain has already allocated that space to other things. So in other words, we need to retrain that part of the brain for literacy and numeracy. As I said, otitis media is a pandemic, which it's a massive public health problem. We need to be making sure we adequately focus resources there, but we also need to be making sure that we make Aboriginal hearing health, and it's the issue and the understanding that if we are to close the gap, we need to be investing critical resources and make it a national priority, that we invest in childhood health, but also in those programs for early literacy and numeracy, so that when children are attending their first day of school, they can hear and they are ready to learn, just as their colleagues who don't have hearing impairment and haven't had otitis media.
Thank you, Senator.